All right, really quick before we get started, please remember to subscribe to this podcast wherever you listen to your podcasts, and feel free to check me out on my website, rhitch.com, for more information. Now, everything said in this episode is for informational purposes only and should not be relied upon as a basis for any investment decisions, retirement planning decisions alone. All statements regarding, companies made or planning strategies are strictly my beliefs and points of view held by myself, and not a recommendation to buy, sell, or hold any securities. All right, welcome to the Financial Breakaway podcast, your clear path to retirement. Again, I'm your host, Ryan Hitchcock. I am a financial planner with High Point Capital Group in Milwaukee, Wisconsin, and it's my goal of this podcast to empower individuals like you to make a confident decision for a secure retirement. All right, so let's talk about retirement planning. Being in my position as a financial planner, I've literally helped hundreds of people to and through retirement. And I've found this interesting observation in retirement planning. When most people hear retirement planning, right, you think about money, you think about investments, and I think that's fair, actually, because when you're in an accumulation phase, like you're building your retirement nest egg, you're saving, you're investing, and you're just focused on growing that pile of money. So that's why you think about that. But the interesting thing is, as people get closer to retirement, maybe a year or a couple years out, their mindset really shifts. And suddenly healthcare becomes their top priority. It's very interesting. And I'd say that's especially true for like the mass affluent individual and families out there that I tend to work with. This shift is very common. So why is there this shift? Why is this shift happening? For one, healthcare is very expensive, obviously, but that becomes more apparent as you get closer to retirement. There's a study done by Fidelity that if you look at a 65-year-old couple and their expected life span is to age 90, they're going to spend at least $360,000 on healthcare. And that's just on like premiums, out of pockets on average. It's not including any long-term care or anything like that. And that's just the minimum. So this number might seem daunting, but in the real world of like planning for healthcare costs, we don't really look at it this way. Just as an FYI, it's usually broken down into more of a budgetary type of number, which could be something we'll dive into another day. But the main reason people get nervous about healthcare in retirement is just the complexity of healthcare. There's unique health situations and specialized medications for everyone, listening or out there, and just figuring out the right path to have for, financially and to get good care in retirement is daunting. So that's an interesting shift I see. So today I want to discuss, more at a high level. I have a quick hit list of 7 items that you don't want to overlook when planning for healthcare in retirement. These 7 items I want to help you understand, one, what is healthcare in retirement? When do you start to get it, and how much does it cost? So let's get into it. Number 1 is Medicare. What is Medicare? So we all hear about Medicare. Medicare is a federal health insurance program, right? In the U.S., it's mainly for individuals when you turn 65. And so retirement healthcare starts at age 65 with Medicare. Now it can cover, younger people with disabilities or other specific conditions, but it's typically at age 65 when you're looking at it in the retirement planning lens. Now Medicare has different parts. There's Part A. So this is called hospital insurance. This covers inpatient hospital stays. It's going to cover some skilled nursing facilities. It's going to be hospice and some other healthcare part. So generally, Part A is hospital insurance. Part B is what they call medical insurance. So this is going to cover like any outpatient care, like going to your normal doctor, preventative services, and some home health care. There's a Part C. This is more what they call like a Medicare Advantage side of the world, where it's offered through private insurance companies. We're going to talk about this. And this is just going to include any additional coverage or any additional benefits that general Medicare does not cover. And then the last part is Part D. And this is Part D for prescription drugs. So together, all these components, Part A, B, C, and D, provide a comprehensive healthcare coverage for eligible individuals in retirement. So that's what, healthcare in retirement is, Medicare. So that's number one. So we got to first know what it is. The second thing is enrollment. When do you get it? So I just said you get it at age 65, but it gets a little bit more complicated than that. So there's what's called enrollment periods. So the first thing that you have to, there's what's called an initial enrollment period. And this is just your first chance to sign up for Medicare. And this starts 3 months before you turn 65. So an initial enrollment period starts 3 months before you turn 65, and it wraps up 3 months after your birthday month, excuse me. So if we do the math on that, you've got a total of 7 months altogether to get everything kind of settled and started in Medicare. If you miss this window, you don't have to panic. There is then what's called a general enrollment period every year. And this happens from January to March 31st. And this is more like, I kind of call it a second chance to enroll, but you might have some late penalties for enrollment and all that. But I just want to make it a note that if you miss your first initial enrollment period, you don't have to panic. You can get back in later. There's also what's called special enrollment periods, and this one's a bit more flexible. It's available if you qualify, I'd say, under certain conditions. For example, if you're working and maybe you're covered under an employer plan and then you lose that coverage, you can sign up for Medicare without facing any penalties. And so it's good to know just these timelines and conditions to make sure you're covered when you need it. So that's number 2. So enrollment periods. Number 3 is, I've kind of talked about it just now, it's if you're working at a normal job, you're 65, and then there's Medicare. Because I just was saying, okay, when you're 65, you have to sign up for Medicare. But what if you're still working and you're covered by a health insurance at work? So what happens here is, let's just say, for example, you're covered by a large employer's health insurance. You can actually delay signing up for Medicare, which is usually, they say, Part B mainly, without paying any penalties. And this can just save you some money because you don't have to pay for the Part B premium, which there is a premium, and I'll talk about how much that is here in a minute. Now, if you're retiring from this employer and they're offering retiree health benefits, meaning you're retired from them, and just like the name states, they're going to offer some health care for you in retirement, you'll want to see how that integrates with Medicare. It's just kind of a crucial part by having a clear understanding of how these retirement benefits work with Medicare. And you want to talk to maybe a specialist in that world so you can have both. But just to continue on kind of the process of what you would do is, if you're 65, working, you have coverage. Have coverage through work. First, what you do is you just file a form with the Medicare office saying that you have this health coverage. Usually your employer will sign off on that as well. And then you're good to go. It's literally one form. Some people really freak out about this, and sometimes if you don't do this, you'll get a bill in the mail from Medicare, and it might be quite expensive. So don't be panicked if that does happen to you. You can still file this form, and they'll take care of retro action on that bill. So then once you turn or once you retire, let's say, you can just file again for another enrollment period. You'd qualify for a special enrollment period to get into Medicare. So that's number 3. So number 4 is, what does Medicare cost? So let's talk about that. And so there are costs associated with Medicare. There's starting with Part A. Usually Part A does not have a premium. So that's just free, if you will. And that's kind of paid through Medicare taxes while you're working. The Part B does have a monthly premium. So if you're receiving Social Security, the premium is usually just deducted directly from your Social Security check. So it's really convenient. It's not like you have to worry about any bills to pay that month. It's going to come right off your Social Security check. If you're not, taking Social Security yet, because, if you remember from some of our past episodes, we're saying you can take Social Security as late as age 70. So if you're not taking Social Security, but you're at least 65 and you're on Medicare, you'll get a direct bill from Medicare for Part B, and you can just pay it directly with them. And that's usually like on a quarterly basis that you can do it. Now for Part D, so that again, that's the Part D is the drug plan, the prescription drug coverage. These are usually set through private insurance companies. And so you'll pay a separate premium specifically for Part D. It's from a private insurance provider and it's not through Medicare. So it's important you'll want to compare plans every year, usually for the cost of this coverage in Part D. And so don't forget, there's going to be deductibles and copays for these, and the amount of out-of-pocket you pay for Medicare coverage kicks in, but that can vary by plan. All right, number 5 is in line with what Medicare costs, and this is just what's called IRMA. So when you're in retirement planning, you're going to talk about this word IRMA, and it stands for Income-Related Monthly Adjustments Amounts. I know it's a mouthful, and it's kind of is what it is type of term, but it will come into play if you don't plan for it. It could really bite you. And so what IRMA does is it's essentially saying if you make more money in retirement than the government kind of lays out, there's a table for it. I'm not going to get into the table right now, but it's like a progressive tax rates. If you go up in the bracket of IRMA, you're going to have higher Part B premiums. And so that jump just from the normal Part B that most people pay, if you end up in the higher brackets, that rate is about 40% higher than just the normal rate. So you definitely want to plan for that, because I've seen people not plan for it at all, and it can really bite you when all of a sudden your Part B premiums are literally 40% higher than you were expecting. All right, number 6 is the Medigap, is covering your gap. So if you're talking or doing some retirement planning, you'll hear about the gaps in Medicare. And so just as an aside, Medicare, again, is this program covering healthcare and retirement, but it does come with coverage gaps. And these gaps refer to just out-of-pocket expenses that the normal parts of Medicare, Part A and Part B, don't cover. And so these gaps can be filled in the private insurance market. And so this is where you see a bunch of, if you're getting close to retirement, you're going to get so much mail and phone calls from people trying to get you to get into some Medigap or private insurance plans. And this is Medicare. There's 2 types. There's either Medicare supplements or Medicare Advantage plans. And I will say this is where most planning is done in the healthcare world for retirement planning, is trying to figure out what plan works best for you in your situation for retirement. Is it going to be the Medicare supplement plan or a Medicare Advantage plan? And I'm not going to get into the differences mainly right now, but at a high level, Medicare Advantage plans usually have lower premiums, but come with maybe some higher out-of-pocket costs or deductibles or copays. So they can be more cost-effective. Maybe if you're healthy and you don't expect to have a lot of medical visits to the doctors and that. The other one is Medicare supplement plans. And these plans generally offer more comprehensive coverage, but they tend to be more expensive, like out of pocket per month. So they might be a better fit for those people who want to have more predictable healthcare costs and are willing to pay a higher premium for, more peace of mind, if you will. Okay, and then the last one. So we're at number 7, and I'm calling this one long-term care. And so the thing I want to get across is that Medicare does not cover long-term care. So what is long-term care? This is different than normal Medicare or medical coverage. So long-term care refers to assistance with daily activities. So that's like bathing, dressing, eating, maybe needing in-home health care or nursing care, or going to a full-fledged, long-term care or nursing home facility. So this is more custodial care, where Medicare is designed to cover more medical needs, not personal care services. So you might be thinking right now, if you've been following me at all here in the very exciting topic of Medicare, you might have said, Ryan, you mentioned in Part A that Part A covers skilled nursing care. Isn't that the same thing as long-term care? It can be. These terms can get synonymous at times, but Part A only covers skilled nursing care for a certain amount of time. And you have to meet certain criteria for you to even be on it. So it's usually only a handful of days 30 to 90 days, depending on the plan, not more than 100. So don't quote me exactly on that, but it's, the Medicare will not cover at a base very long time for long-term care services. So you want to understand that as you go into, planning for healthcare, and you want to, then figure out if long-term care is something you need to cover in a different type of policy. So let's wrap it up here. These 7 items, these seven essential items, I think are just kind of the foundation for a solid healthcare plan in retirement. The things you need to kind of walk through to make sure you're comfortable with your healthcare in, as you get closer to retirement. I think each one, requires some careful consideration and planning to ensure that, you have the coverage you need at a cost that you are comfortable with and can afford. Because remember, healthcare planning is not just about costs. It's about ensuring you have access to the care you need when you need it the most. So as always, consult with a financial planner, insurance specialist that can, help you create a personalized plan and help you give insights to, your unique situation. So with that, I will leave you until next time. So be well. Thank you. High Point Capital Group is located at 1200 North Mayfair Road, Suite 300, Milwaukee, Wisconsin 53226. Phone number 414-253-4600. Securities and investment advisory services offered through Osaic Wealth, Inc., member FINRA, SIPC. Osaic Wealth is separately owned in other entities and/or marketing names, products, or services referenced here are independent of Osaic Wealth. Views expressed here should not be construed directly or indirectly as an offer to buy or sell any securities or services mentioned here. Investing is subject to risks, including loss of principal. Past performance is not a guarantee of future results. Indexes are unmanaged and investors are not able to invest directly into any index. Sector investing may involve a greater degree of risk than investments with broader diversification. However, there is no guarantee that a diversified portfolio alone will outperform a non-diversified portfolio in any given market environment. No investment strategy, such as asset allocation, can guarantee a profit or protect against loss in periods of declining values. Please note that individual situations can vary. Therefore, information should only be relied upon and coordinated with individual professional advice. Ryan Hitchcock believes the information presented here is accurate and was obtained from sources that are believed to be reliable. However, Ryan does not guarantee the accuracy or completeness of any information, and such information may be subject to change without notice from Ryan. Statements expressed by guests on this podcast are the views of those guests only and not of Ryan Hitchcock. Statements contained in this podcast may be statements of future expectations and other forward-looking statements that are based on Ryan Hitchcock's or guests' current views and assumptions and involve known and or unknown risks and uncertainties that could cause actual results, performance, or events to differ materially from those expressed or implied in such statements.